G'day guys. Today this video will entail myself discussing what a functional capacity evaluation screening assessment should look like. And the first thing that we're going to go through is a subjective assessment with the patient. So we're going to have a chat to the patient about their injury and get a better understanding about what the pathology is or how the workplace accident occurred. So then we can therefore assess a different number of outcome measures specific to that individual. The next thing we're going to want to do is we're going to want to gain a pre-screening, an ESSA pre-screening tool assessment. So this involves, you can get this from the ESSA book, and basically it involves the worker going through a number of yes or no questions, and the assessment basically looks to see at how many risk factors this person has and whether or not it is safe for them to actually go on with this assessment and complete some physical activity. If they are not safe, we can happily refer them back to the doctor to get that cleared off or medical clearance. The next thing that we're going to do in the assessment is complete some basic objective measurements. So the first thing we're going to look at is the worker's blood pressure, and that will be done in sitting. And this is just to make sure that they're in that safe limit to go and do some exercise. So, if the patient's getting anything like 160, 170, 180, that's going to be quite alarming. So we'd probably cease the testing for the day, or just let the person cool down for a little bit, let them have a cuppa or relax for a little bit, read the newspaper and come back and see how they're going. Following the blood pressure, we're then going to get their heart rate at resting. So we can use a pulse oximeter, and that can give us a resting measure, and it will give us also some SATs too, which is also handy. If that's not available, we can take a measurement at the radial artery, hold it there for 10 seconds or 15 seconds, and once again, if we're seeing resting heart rates of 110 or 120 at rest, that will be quite concerning. So we'll probably want to just let the patient calm down or cool down for a little bit. Values between 50 to 100 is going to be quite normal. So the next thing we're going to do is we're going to complete a posture assessment. So what the person we would instruct them to do is marching up and down on the spot, and then getting them just to relax as per normal. And once they're relaxed, the clinician will come around. They'll inspect the person from anterior view first, and they'll be looking for things like AC joint symmetry. They'll be looking at knee valgus. And then they'll go to sort of the coronal plane or frontal plane, and they'll be then looking for sort of the curvatures in the spine, your lumbar, thoracic, cervical, looking if there's any sort of lordosis or kyphosis present. From there, we'll then move on to posterior aspect, and we'll be looking at more at the scapula for the upper body. So we'll support the scapula, and we'll take the shoulder joint into abduction, just looking for any sort of irregular sort of movements. Scapula should feel smooth. If it's jerky, there could be a dysfunction at the shoulder joint. Moving on, specific to the case study, an active range of motion test would be completed. And for this person, he's got an ankle injury and he's also got a shoulder injury. So we're going to look at those two joints. For the shoulder, we're going to assess the active range of motion through all the movements that the shoulder can perform. So we've got shoulder flexion, we've got shoulder extension, we've got horizontal flexion. We've also got internal rotation at 0 degrees, so turning it in, external rotation at 0, internal rotation at 90, external rotation at 90. So they're the things that we're going to be assessing, and we can we'll record down values of the degrees that the joint can move through, because that's quite valuable. So then we can compare that to what range of motion he actually needs for his work. So that would be the shoulder. And then for ankle, we'll get the person into supine, and we'll look at ankle plantar flexion, We'd also look at ankle dorsiflexion, and we'd also look at supination and pronation. So they're the 4 movements that we'll be looking at the ankle. We'll compare the left and the right side and get a bit of a baseline as to what type of movements and how much range he has for those joints. The empty can test is a test which sort of measures the integrity of the rotator cuff, the performance of the rotator cuff. In particular, the supraspinatus, which is a muscle which is a muscle in the rotator cuff group. So for this work, he does a lot of overhead work, or he does some sorting overhead. So this is a good test to see if there's any sort of impingement with the supraspinatus, which hooks onto close to the AC joint. So what we'd instruct the person to do is to come into scaption, which is basically halfway between 90 degrees abduction. So say 30 degrees abduction and coming up into full flexion. Okay, we'll get the person to have thumbs down. Okay, and what the clinician will do is they'll put pressure down there, saying try and win, try beat me, try beat me, try beat me. Person's pushing up, and then we'll measure the other side. So pushing down, person's pushing up. FCA step test. This is a test that goes for 3 minutes, and it involves the person stepping to a metronome of 96 beats per minute onto a step that's 40 centimeters high, and they must step in time with the beats. So you'd set up a metronome. It would be 1, 2, down, down, 1, 2, down, down. And it's important that you instruct the worker that at any time during the test that he can or she can stop for whatever reason. They can stop and cease the test at any time. If there's any sort of indication that the person looking dizzy or there's balance issues, it would be another idea to cease the test then. So this is a test looking at cardiovascular fitness, and it also helps us to identify if there's any sort of cardiovascular risk factors. So if he's feeling short of breath, or if he's pulling out early from the test, that would sort of ring some alarm bells that maybe the cardiovascular fitness isn't that great. 1 minute following the test, we would get the person's heart rate, and we would record that down, and there's a bit of an equation that we can use to then develop his VO2 max or aerobic baseline. The next test we're going to go through is the Knight's kneel test. So this is a test that sort of looks at measuring the endurance and the posture of the lower limb. So what you instruct the person to do is to come down onto one knee. Okay, the person must hold this posture for 30 seconds. Once they've held the posture for 30 seconds, you instruct them to come up without using their hands. And that's basically it. So if the person has to adjust their posture during the 30 seconds, you would note that down. But if the person can maintain the integrity of the joints of the lower limb whilst holding that kneeling position, that would be a successful outcome from the test. What we're going to do is the 30-second full sustained squat. So for this one, you can get the person to do some light sorting activities during the squat, or you can just get them to do the squat all the way down. So this is a test that's looking at the lower body balance and flexibility. So all you tell the person to do is get into a comfortable stance and to go down, bring their hips down, bending their knees as far as they can. Their heels can come off the floor. You'd note that down, and the person is going to hold this position for 30 seconds. So squat. You can get them to do some sorting activities, and then they'll come up. The next task we're going to go through is a manual handling task. This is a lot more specific to the person's job. The first one we're going to do is picking up an item that's 2.5 kilos from the floor, bringing it up to waist height to a bench. The person is going to complete this 3 times. We're really looking to see if the person can do it safely with good technique and with good form mainly. Okay, so you do it 3 times with 2.5 kilos, and we can work all the way up to 10 kilos, 15 kilos, 20 kilos is the max. So once if the person agrees to increasing, would increase by 2.5 to 5 kilos, and once we reach 15 or 20 kilos, that's when we would cease the testing. So, for example, person starts here, picks up the item, places it, comes back down, and that's 3 times. So then what we'd then do is we'd go increase the weight, put more weight into the box, okay, 2.5 or 5 kilos, ask the person to go again 3 times, picking it up, putting it on the bench, taking it down, putting it on the floor. Okay, the last test we're going to do is continuing on from the last manual handling task. So we're going to now pick up the item from waist height and bring it up to overhead height. So we're going to get the person to start with no weight. So this has got nothing in there. I'm going to pick it up, place it up, take it down, take it up. Okay, 3 times. If the person does that successfully, we increase 2.5 to 5 kilos and we begin again. So we're asking the person, how they're feeling, is there any fatigue, any joint pain, discomfort, things like that. If technique breaks down or there is pain, it doesn't necessarily mean the person can't go and complete their work. It just means we might need to modify the amount that they're doing. This is all information that we'll record and we'll pass on in the report.